Hi, this is Alice with Peds Teletherapy. Today we're going to talk about an infant's head shape. All babies, when they're born, whether that's vaginally or by C-section, come out with different head shapes, and there is no one perfect head shape. But the reason head shape is important is because as a baby grows and their skull and their head formation becomes more mature, it can affect the alignment of the eyes, the alignment of the ears, alignment of the jaw, some of the functional things we have if your head is shaped off center on one side. It also has a social ramification. If for some reason a child's head is very flat on one side or the front is slightly flat or lumpy, as he grows, that could be a social problem for that child. So head shape is very important. We now know that it's very important to put our babies to sleep on their back for back to sleep. It prevents SIDS deaths. Now, what can occur sometimes is if a baby gets stuck in one position and is always sleeping on his back and has pressure to the back of the skull, it can cause that pressure to make the skull uneven with its growth. So there's 3 types of abnormal head malformations that occur. First one is called brachiocephaly. And you'll notice that is when a child has been sleeping flat on his back and the pressure is equal on both sides of the back and the whole back of the head equally looks flat. That's brachiocephaly. Another one is plagiocephaly, and that occurs when a child tends to sleep with his head tilted to one side. As you can imagine, if I was sleeping this way, pressure would be on this one part of my skull. You'd get flattening there, and towards the other side of the posterior aspect, you might get a bump. That's plagiocephaly. And the last one is scaphocephaly. That's if a child is for some reason sleeping completely on his side. It could be a child that was in the hospital floor long term and was on his side frequently, and the head is very, very flat on the sides and protruding more in the front and back. The most common one I tend to see is the plagiocephaly. So let's talk about that. What's important is during that first 6 months of your baby's life, when they're awake, is to give them more and more opportunities to be off their back. You want them sleeping on their back, but when you're holding them or when they're awake, they need more time off their back. So one of the things that's most important is to keep your baby out of any containers as much as possible. And what do I mean by containers? Car seats, infant bouncy seats, anything that pretty much mimics putting pressure on the back of their head. They're going to get pressure on the back of their head and their body while they're sleeping. They don't need more time throughout the day in a reclined sleeper or an infant bouncing seat or in the car seat where they're getting that same amount of pressure. Also important to make sure your baby doesn't have a preference for turning his head one way or the other, right or left, when you do put him down to sleep. Make sure sometimes you put them to sleep and they're on their head to the right. Sometimes they're on the back, head to the left. You can also help that baby want to turn his head both ways by when you come into the room and you approach the crib. Sometimes approach the crib from the right, so he wants to turn his head to the right. Sometimes approach the crib from the left, so that baby might want to turn his head to the left. Also, holding your baby. Make sure whenever you're holding your baby, whether it's in your arms, on your chest, however you hold them, their head is not always in the same position. Sometimes their head should go right, sometimes their head should go left. The same thing with when you're breastfeeding. Make sure when you're breastfeeding, I'm going to get my little doll here as an example. When you're breastfeeding your baby, make sure that sometimes it is on the right, head would be turning right now this way, and sometimes you rotate it to the other direction, and the head would be this way. Similar as we were talking about when you're holding and burping, maybe sometimes the head is facing out, maybe sometimes it's facing in. Okay, all those things are important. It's also important, again, as we reviewed in one of our other videos, to give them lots of opportunity for awake time on their tummy. We suggest doing this 3 times a day minimally in that first 6 months, where you're lying on a couch and the baby's against your chest or across your lap or on the floor, but you're doing supervised awake tummy time. That also helps the pressure across the front of the forehead and therefore sort of balancing out when they get all that pressure in the back. If you're not sure if you're doing enough or your child is having any problems, 3 things to remember. 1, these are sort of red flags that you might see if you need to talk to a physician or a physical therapist about. 1, does your baby tend to hold their head tilted a lot or turn to one side more than the other? If you see that, try to work on doing the opposite before you seek any guidance. Secondly, is a baby struggling with nursing or feeding on one side only? If one side is super easy and the other side is really hard, that might be an indication again that the skull shape has gotten abnormal, and when that happens, sometimes the muscles can tighten on one side. 3, if you're starting to notice that your baby's head is flat more on one side of that front, the back, or the side. All babies' heads are not perfectly symmetric, but you shouldn't be noticing, boy, there's a big flattening on one side, whether that's the side or the back of the head. 4, if the baby's avoiding turning their head to one side. So if you are playing with your child and you're trying to turn their head this way or that way, and maybe you're using a nice colorful toy to get them to look that way, and you notice they're not wanting to turn one way or the other, that would be a red flag. And 5, if your baby really prefers to only use one hand at all times to reach or pull his hand to his mouth, that also can be a sign that maybe some muscles are tight in the neck from a flattening on the back of the head. So I want you to work on these things to make sure that your baby's head and skull becomes symmetric and beautifully shaped. If you see any of these red flags I just talked about, or you yourself are concerned, please talk to your pediatrician or a PT. Within that first 1 to 3 months is the best time. I hope this helped. Have a great day. And if you have more questions, you can go to my website, pedsteletherapy.com, or you can also email me directly, alice@pedstherapy.com.